I'm going to have the pleasure of calling on Dr. Philip Idaewor. Dr. Philip Idaewor is a medical practitioner also working in the NHS. He trained in Nigeria and was previously a lecturer in histopathology, cellular pathology at the University of Benin Medical School, Benin City, Nigeria. He's still practicing this specialty in the UK. Dr. Idaewor is an active member of the Pro-Democracy Network in Nigeria and a founding member of the Alliance for Democracy and the All Progressive Party, APC. He has remained active in party politics and the chair of the UK chapter of Nigeria's current ruling party, the APC. Dr. Idaewor is going to share with us his insight into mental health and the impact that COVID-19 has brought on. Dr. Idaewor.
Yeah, thank you very much, Sosa, and thank you, Katie, for having me on the platform. As the introductions have already pointed out, as you hear, I'm not a mental health person at all. And indeed, my specialty, I'm not a patient-facing practitioner at all. And so I want to thank Dr. Idaewor and Dr. Motayo for the highlights and the deep diving they have given to us with regard to how we ought to be dealing with the issues of mental health, as well as the issues of signposting patients, and particularly in our community. For me, as a histopathologist or a cellular pathologist, it's all about the science of this disease of SARS-CoV-2. And we see that, from my point of view, one of the big causes of mental health challenges that people are faced with is either the lack of information, or mostly because of poor or wrong information being transmitted about this virus all around, which some people have dubbed conspiracy theories flowing all over the place. You hear people talk about the virus as if it is not a virus. So the first question for me is, SARS-2, is it a virus at all? Is this actually a virus, or is just a particle, or what is this virus that we talk about? And I think that we need to be able to convince our communities that this is a virus. People talk about this virus being manufactured in a lab. Well, I don't know about that. What I can say for certain is that within this family of viruses, you have several of them. And actually, the virus responsible for COVID-19 is the third to have full impact on the human population. We had the first one in 2002, which we should have called SARS-CoV-1. That happened as well in China. But we also have had the Middle Eastern, the MERS virus. That was actually the SARS-CoV-2. So, in effect, the virus that is being called SARS-CoV-2 at the moment should have been SARS-CoV-3. So, we know that this virus exists because it has caused diseases in the past. We know that the diseases that have been described are real. When this started, what was responsible for the high mortality and the high morbidity in patients was actually not clear. You know, you had people who were describing all kinds of things, and it was at that point in time, the point was that for those patients who were intubated, the outcome tended to be poorer. And no one can understand that. But we know today, we do know now that the virus causes varied problems, but particularly in the lungs, even when the patient do not present with lung-associated changes. So you have patients who will present with diarrhea, and yet their lungs, is completely hammered by the virus. Dr. Idaewor spoke about the issue of long COVID. The impact of the virus on the lungs is not just immediate. just 2 weeks ago, there was the first main publication of the long-term impact of this virus on the lungs. And it is clear that beyond the acute changes, you have fibrotic changes, you have long-term changes that damage the lungs and leave scars in the lungs for a long period of time. How is this virus also affecting the nervous system? Are things that are being understood. I would like to probably point us to how people responded to HIV virus when it was first discovered or when it first came on stream. There were many people who believed that the HIV virus was manufactured in the lab and was poured out into the human population to deal or to exterminate a certain group of individuals. And there were people who held to that view for, very strongly for a long time. So I think that the question of how the governments have communicated the science of SARS-2 has been key to how a lot of people have responded to it, and therefore the underlying challenges of the conspiracy theories that have flowed about in all kinds of platforms. The second thing I want to probably touch on is the vaccine itself. Again, we see the anxiety and the troubles that is being generated in the minds of so many people by commentaries made by some high level individuals who are investors in the past. And therefore, people feel that the vaccine is being developed to eliminate or to exterminate or to bring down the population of, in our own case, the Africans, the Black people worldwide. So we need to ask ourselves how it is so easy for science to cooperate with politicians to target a particular population. And I think, again, it is about how we communicate the science of the vaccine, the various vaccines, to the communities and to the world population that is at play here and is key and is going to be critical to whether or not so many people are going to be willing to accept the vaccines that are meant to help the world control this pandemic. The sociological challenges or solutions like social distancing, wearing face masks, and all of that have been put forward. Yes, they are working, but we have to accept the fact and the reality that science will still have to be at the forefront of providing solutions to the problem of this pandemic, of this virus. And for me, as somebody who deals with the tangible evidence of science and diagnostics, it is how our governments around the world, for us in the UK, speaking from the UK, for those of us who are from African countries, how our governments embrace science and let their communication become more science-led, such that they are able to actively and deliberately come out to deal with the issues, the challenges, and the propaganda being generated by those who figure that this virus is being lab manufactured to cut down the world population. I think that as speaking from the mental health point of view, I think that for the mental health physicians, this is an area that they need to probably be able to interrogate more and advise how best to deal with. As I said, I'm a diagnostic person. So I make diagnoses and convey that information to patient-facing clinicians. And it is, for me, it is about science. And I think that the science of this virus, the science of this pandemic has been very poorly handled. Lastly, it is, for us, again, in the UK, it is about how diversity at that level of managing the science, the communication of science of this pandemic of COVID-19 has been portrayed. every evening, most of us will probably be sat in front of our television and we see the Prime Minister flanked by the Chief Scientific Advisor, as well as the other persons who advise them, who advise him, who advise government on this issue. And what do you see? Most of the time, it is the typical picture of white male middle class faces making presentations on something that is having potential impact on a multicultural society. And therefore, that helps to further the message that it's all about targeting or giving information out or selective information out to deal with certain persons. So diversity in managing the communication of science in dealing with this pandemic, I think, again, is something that we have to look at. And that is the point that the statement made by Dr. Motai, I think, is very important. That the medical practitioners or healthcare workers who are Africans in origin or who are of the BAME community need to step forward to bridge this gap. It is my view that SARS-CoV-2, the cause of COVID-19, is real. It is also my view that based on the science available, the information, the historical evidence of the science of this virus, and as we can see from the mutations that are happening, which is typical of any virus. The viruses are very clever little animals. They don't like to be caught out. They don't behave like bacteria, neither do they behave like parasites. Once they take a foothold in a community, the next thing they do is to begin to change their forms and their DNA to escape being eliminated. And that is what we are seeing. And we know that in the past 2 or 3 weeks, we have had up to 2 or 3 new mutations of this virus. That is typical of how viruses behave. So I would say that for us, as we watch information that flows about on social media platforms, and as we interface with all this information, I take us back to this, the statement by Dr. Idaewor. Our sources of information, we have to ensure that they are credible. It's a deliberate decision that each and every one of us need to make, and to accept that a virus is a virus. SARS-CoV-2 is a virus. It is not a piece of metal. It is, and the vaccine itself is also not a piece of metal. I give you an example of what I'm saying here. There was the time that statements were moving about the nanoparticle in the virus, in the vaccine, and therefore people began to extrapolate that because they talked about nanoparticles, it means that they were going to infuse chips into the human body. Bottom line, the nanoparticle simply talks about the size of the particle. That is all. It has nothing to do with metals. So I say that I'm more concerned about how both from my psychiatrist colleagues on the platform and from other healthcare workers, as well as social scientists who I'm sure who are here, it's how we communicate science and how we make deliberate effort to ensure that our communities are made better informed, that science should lead in how we respond to this pandemic. Allowing any other source of information to lead can only increase and cause more problems with regard to the mental health challenges that we are currently faced with. And it will only get worse if the issue of communicating science appropriately is not dealt with. So thank you very much for listening to me, and thank you for having me on the platform.
Thank you very much, Dr. Idaewor. That was very good. You have again amplified what Dr. Idaewor and Dr. Motai you've talked about. What you are saying that the virus is real, the question of the vaccine, and it's all about sociological challenges, that we should accept the fact and the reality that science has to be at the forefront of providing solutions. And another thing you are saying is that science and the politicians cannot be wrong. This is what we need, that there should be tangible evidence of science and the diagnosis, that how our government embrace science and let their communication be science-led. And you've also talked about the science of the virus, and that the pandemic has been poorly handled, but communication is key to handling and to engaging our community. That what we see every time we look at the press conferences are faces that do not reflect us. And again, as Catherine Omotayo said, Dr. Omotayo said, we need to be at the table. We need to be saying what is happening, how it's affecting us, because it's a good time. And then also what you said is that healthcare workers who are Africans need to step up and forward an historical evidence that science is a virus, and that as we watch information that flows from social media, we need to ensure that our sources are credible, and that a virus is a virus and not just a piece of metal, and that the vaccine itself is also not a piece of metal, but designed for the body. Thank you very much. We've got questions now